Today I will discuss 5 situations when psychiatric medications can be helpful to reduce the aggressive behavior in a child. Number 1, safety concern. When the aggression becomes severe, when the child endangers the safety of others, when the child is constantly kicking, hitting, biting, scratching, trying self-injurious behavior, many of the situations these children are admitted to the hospital. Medications are used as a chemical restraint to buy time so that they can learn other healthy coping skills through therapy. Number 2, serious mental illness. Sometimes aggressive behavior can be due to underlying serious mental illness like bipolar disorder, schizophrenia. In case of bipolar manic episode, a child may have too much energy, children may become disinhibited, they may resort to aggressive and other problematic behavior which they may not remember later on. It is very important to medicate the child with mood stabilizers to control the mania. Although psychosis is rare in children, that still can happen when children start hearing voices and respond to internal stimuli in a pathological way. In those situations, it is important to medicate the child, to calm the child and prevent the child from acting out on the external stimulus that the child is hearing or seeing. Number 3, ADHD. If aggression is due to hyperactivity and inability to focus, then treating the ADHD many times will also reduce the aggression and other problematic behavior. Many children with hyperactivity who also have aggressive and uncontrolled behavior, when they are treated with stimulant like Adderall, Ritalin or methylphenidate, they show a reduction in the symptoms. Also, the use of antihypertensive medication like clonidine and guanfacine can also improve the sleep of the child and calm them during the day. Number 4, insomnia. Many times, for whatever reason, children may not be able to sleep at night. They may have too much anxiety, they may have too much depression, too many things going on in their mind. Helping them sleep at night can reduce their behavioral problems during the daytime. For sleep, generally I recommend the use of melatonin and magnesium supplement as a first try. If the sleep problems persist despite of using them and despite of following sleep hygiene, then other sleep medications like trazodone or Benadryl can be used. Number 5, children with special needs. Children with special needs like autism spectrum disorder may have unique challenges. They may have speech impairment, they may have intellectual impairment, they may be having developmental delay. Sometimes the aggression may be part of the irritability symptoms associated with the autism. Many times they are best treated with behavioral therapy, specifically applied behavioral analysis, speech therapy and occupational therapy. Many times when this therapy fails, medication are used to control the problematic behavior. Abilify and Risperdal are 2 medications approved for use in children with autism with irritability. I made a detailed video on these 2 medications. If you want to know more about them, check the link below. In summary, medications are not the ideal choice to treat the aggressive behavior in children. Best way is the use of coping skills, discipline, structure, behavioral therapy. I reserve medications only as a last resort when everything else fails.